If you've ever avoided certain foods, canceled plans, or panicked over a stomach bug just to make sure you don't throw up, you're not alone, and you're not broken. There's actually a name for this fear, emetophobia. Most people don't like the idea of throwing up, but for some, it's not just uncomfortable, it's terrifying. It's more than a dislike. It's a deep, overwhelming fear that can take over every part of your life. From skipping meals and social events to avoiding travel, pregnancy, or even the idea of having kids. This fear can shrink your world in ways most people don't understand. It's called emetophobia, and even though millions of people live with it, barely anyone talks about it. So what exactly is emetophobia? Why does it happen? And most importantly, can you actually overcome it? At its core, emetophobia is an intense, irrational fear of vomiting, seeing vomit, or even feeling nauseous. In fact, me even saying that word may have already triggered some of you who struggle with this. Now you might think, okay, nobody enjoys throwing up or talking about it, Katie, so why is this a phobia? Here's the difference. Most people feel sick, throw up, and move on. Sure, we don't like it or want to feel sick, but it happens and it sucks. But we don't spend our time worrying about it happening again. Someone with emetophobia will do everything possible to avoid vomiting, even if it completely disrupts their life. For some, it's just about themselves. For others, even seeing someone else vomit is terrifying. Things they can do to try and prevent getting sick is avoiding certain foods that have either made them sick in the past or ones they know have a higher likelihood of food poisoning. These are often things like oysters, eating at a buffet, having over-easy eggs, or even eating a steak not well done. Others will stop eating at restaurants or even limit social interactions to stay, quote unquote, safe, afraid that if they don't prepare the meal themselves, that they're increasing their risk of getting sick. For some, they can even be so afraid of vomiting that they won't have children because pregnancy often means morning sickness, and that can last for much of the first trimester. Not to mention that once you have a child, they can get sick too. Children are constantly catching colds, eating too much candy or rich foods, and throwing up. And caring for a sick child, to those with emetophobia, can feel unbearable. Like most phobias, emetophobia starts somewhere. Here are 3 of the most common causes. Number 1, a bad or traumatic vomiting experience in childhood. Maybe you got food poisoning, threw up in class, or had a stomach bug that felt traumatic. Many of my past patients have shared that not only was the experience bad or uncomfortable, but it's usually paired with it being embarrassing or at a place or time when they couldn't get to the toilet. Therefore, connecting throwing up with being embarrassed or out of control, etc., which leads nicely into the second common cause, which is anxiety disorders. If your brain already leans towards catastrophic thinking, it can latch onto vomiting as the worst possible thing, leading to the development or exacerbation of emetophobia. Emetophobia often intersects significantly with social anxiety due to the fear of embarrassment, judgment, or negative evaluation by others if vomiting were to occur in public or in a social setting. Those of us with emetophobia may become increasingly withdrawn, avoiding situations where we perceive a risk of illness, embarrassment, or loss of control. Additionally, emetophobia can amplify generalized anxiety and uncontrollable worry, as the fear becomes pervasive and persistent, extending beyond specific scenarios to our everyday life. This persistent fear can lead to hypervigilance, constant monitoring of bodily sensations, and heightened anticipatory anxiety about situations perceived as threatening or uncontrollable. Not to mention that anxiety can cause us to feel nauseous all on its own. Therefore, when it's paired with emetophobia, they can feed into each other, creating a vicious cycle where our anxiety amplifies our nausea. Nausea intensifies our fears of vomiting, and the heightened fears further escalate our anxiety, ultimately snowballing into overwhelming distress. Number 3, control issues. Throwing up is inherently unpredictable and uncontrollable, which can make it feel especially threatening to individuals who prefer structure, certainty, and perfection. Because vomiting is a spontaneous bodily reaction that cannot be easily stopped or managed. It can represent the ultimate loss of personal autonomy. This fear can trigger significant stress around any situation that could lead to nausea, illness, or embarrassment related to vomiting, reinforcing a need for heightened vigilance, avoidance behaviors, and meticulous planning to prevent such scenarios. Over time, this intense need for control can escalate anxiety disorders, fueling those obsessive worries about vomiting and exacerbating the phobia even further. And that's where the brain comes in, turning fear into a self-perpetuating cycle. Instead of easing your distress, your brain, in an attempt to protect you, really, actually strengthens the phobia, making it even harder to break free. The brain is wired for survival, and when it detects a potential threat, right, like our nervous system's wired for this. It looks out into our environment, always seeking any potential threat, whether real or perceived, and then it goes into overdrive to keep us safe. In the case of emetophobia, your brain starts associating anything remotely linked to vomiting, certain foods, crowded places, or even feeling slightly nauseous. It links it immediately to danger. And over time, these triggers become deeply ingrained, leading to an automatic fear response, even when there's no real risk. This process is fueled by negative reinforcement. The more you avoid something out of fear, the more threatening it seems. Your brain misinterprets avoidance as proof that the danger was real and that staying away was the right call. It learns, I didn't vomit because I avoided that situation, so avoidance must be keeping me safe. But instead of protecting you, this pattern actually strengthens the fear, making everyday experiences feel riskier and shrinking the world around you. The result? Avoidance doesn't just maintain the phobia, it makes it grow, convincing your brain that vomiting is the ultimate catastrophe, when in reality, it's a normal bodily function that most people experience and move past without a second thought. Emetophobia isn't just about being grossed out by vomiting. It's a full-blown anxiety disorder that can take over a person's life. And while it can affect anyone, certain people are more vulnerable to developing it, particularly those who already struggle with heightened anxiety, rigid thinking patterns, or an intense need for control. Here's why generalized anxiety disorder, or GAD, obsessive compulsive disorder, OCD, people with GAD tend to experience excessive, uncontrollable worry about a variety of situations, and their minds often latch on to worst-case scenarios. Those with OCD may engage in repetitive thoughts or compulsions related to cleanliness, illness, or control. Someone with emetophobia might constantly monitor their body for signs of nausea, excessively wash their hands to avoid any germs, or develop strict eating rituals to prevent getting sick. For example, they might only eat bland foods, avoid restaurants, or refuse to eat at certain times of day for fear of triggering the nausea. Panic disorders. Nausea is a common symptom of panic attacks, which can create a terrifying cycle for those prone to panic disorder. If someone experiences nausea during an anxiety episode, their brain may misinterpret it as the beginning of an actual stomach illness. Over time, this leads to an intense fear that any nausea, even from stress or an empty stomach, means they're about to vomit. This can cause them to fear their own bodily sensations, making panic attacks even worse. For example, someone with emetophobia might avoid working out because an increased heart rate or dizziness makes them think they're getting sick, when in reality, it's just a normal bodily response to exertion. Perfectionism and the need for control. People who are highly perfectionistic often struggle with the idea of being vulnerable or out of control, and vomiting is the ultimate act of losing control. This fear can extend beyond just getting sick. Many perfectionists with emetophobia fear vomiting in front of others because they worry about the embarrassment, looking weak, or being judged. For example, they might refuse to take public transportation or go on long car rides where they can't escape if they feel queasy. And when emetophobia becomes severe, it can lead to extreme avoidance behaviors that interfere with our daily life. Some of us might even stop eating certain foods for fear of food poisoning. We could limit our social activities to avoid potentially sick people, or refuse to travel because we're afraid that we're going to get motion sickness. Others might even avoid hospitals, schools, or workplaces, places where vomiting might happen, severely restricting our independence and quality of life. In short, emetophobia isn't just about disliking vomiting. For those who struggle with it, the fear can dictate where they can and cannot go, what they can and cannot eat, and really how they live, often in ways that feel impossible to control. Can you overcome emetophobia? Yes, but the key is rewiring your brain, which means doing the exact opposite of what your phobia tells you to do. I know you hate it already, but just stick with me for a second. I will tell you how to do this so you don't have to live the rest of your life worrying about getting sick. Here are the things that actually help. And for the record, these aren't just things that therapists say work. These are things that are also supported in the emetophobia Reddit thread. I went down a whole rabbit hole. Trust me. I checked, I read them all so that you don't have to. Without further ado, first up is exposure therapy. Yes, I know it sounds terrifying and overwhelming, but trust me, it does work. This is the method most therapists recommend, and countless people who have overcome emetophobia swear by it. The idea behind exposure therapy is simple. By gradually and strategically exposing yourself to your triggers in a controlled way, you can retrain your brain to stop associating them with danger. Over time, this helps reduce the intense fear response. And no, this doesn't mean that you'll be forced to vomit. Instead, exposure is about desensitizing your brain to the idea of vomiting. It starts with small, manageable steps, like saying the word vomit out loud, watching a scene in a movie where a character throws up, or listening to a sound effect of gagging. I know. As you build up your tolerance, you move up to more challenging exposures, like being around someone who feels sick or eating a food you would normally avoid. The key to this is consistency. The more your brain realizes that vomiting, while unpleasant, is not dangerous or catastrophic, the less power the phobia has over you. Number 2, we have cognitive behavioral therapy, or CBT. This is another highly recommended treatment, both by therapists and by countless people in Reddit discussions who have successfully worked through their emetophobia. CBT focuses on identifying and challenging the thoughts that make vomiting feel dangerous, helping to break the cycle of fear and avoidance. And here's how it works. First, you identify the irrational or exaggerated thoughts that are fueling your fear. Things like, if I throw up, I won't be able to handle it. Or if someone vomits near me, I'm definitely going to get sick too. These thoughts often stem from past experiences. So part of the process is reflecting on when and how your fear started. Was there like a specific moment, like a bad stomach virus, food poisoning, or seeing someone else get sick that left this lasting impression? Once you pinpoint the root of your fear, you can start challenging the beliefs that are formed around it. Instead of automatically assuming vomiting is unbearable or dangerous, you learn to reframe it with more realistic thoughts, like, vomiting is unpleasant, but I've gotten through it before. I can handle it again if needed. Over time, this shift in thinking helps weaken the fear, and it breaks the hold that it has over you. Then you work on reframing these thoughts with more balanced, realistic ones, like, vomiting is unpleasant, but I've survived it before, and I can handle it if it happens. Or being around someone who's sick doesn't automatically mean I'll get sick. CBT also helps you confront safety behaviors, the little rituals and avoidance patterns that reinforce the fear. For example, if you always carry anti-nausea medication just in case, or avoid eating in public for fear of feeling sick, CBT helps you slowly let go of these habits so that you can regain confidence in your ability to cope. Many people in the Reddit thread mentioned that CBT was a game changer for them, especially when paired with exposure therapy. It helps take the emotional intensity out of the fear, making it feel less overwhelming and more manageable over time. And number 3, medication if needed. For some people, therapy alone just isn't enough to manage emetophobia. So if the fear is severe and is significantly impacting your daily life, medication can be a helpful tool. Many people in online discussions, including Reddit threads, have mentioned that anxiety medication made their symptoms more manageable, especially when used alongside therapy. If you're considering medication, it's best to consult with your psychiatrist or a doctor who can help determine the right option for you. There are a few different types of medications that may help that you might want to ask about. Things like selective serotonin reuptake inhibitors, or SSRIs. These are commonly prescribed for anxiety disorders and OCD, both of which are often linked to emetophobia. Also medications like fluoxetine, which is Prozac, or citrulline, which is Zoloft, and citalopram, which is Lexapro. Those can help reduce obsessive fears and decrease overall anxiety. Benzodiazepines, medications like Ativan or Klonopin, work quickly to relieve acute anxiety, but they're typically used for short-term or situational relief due to the risk of dependence. Some people use them for particularly anxiety-inducing situations like travel or a doctor's appointment. There's also beta blockers. While not an anti-anxiety medication, beta blockers like propranolol can help manage the physical symptoms of anxiety, such as racing heart, shaking, or nausea, which can be especially helpful for those who fear nausea-inducing panic. And then, of course, there is anti-nausea medications. Some people with emetophobia feel reassured by having anti-nausea meds like Zofran or I think it's Fenregan. I don't know if I'm saying that right, but having those on hand. However, relying too much on these can reinforce avoidance behaviors rather than addressing the underlying fear. So please discuss all these options with your therapist as well as your doctor to ensure it's a good fit for you and your treatment. Medication isn't a cure-all, but for some, it provides enough relief to make therapy more effective. If your fear of vomiting is making it hard to function, a psychiatrist can help you decide if medication is the right step for you. If you struggle with emetophobia, know this: you are not alone, and this is something you can definitely overcome. So many people have been where you are, trapped in the cycle of fear and avoidance, thinking they'd never be free from it. But recovery is possible. With the right tools, support, and patience, you can retrain your brain and take your life back. Your brain might be telling you that vomiting is the worst thing in the world, that you can't handle it, that you must avoid it at all costs. But here's the truth. Your brain is lying. This fear feels impossible to escape, but it's not. It's just anxiety trying to keep you stuck. And just like countless others have broken free from emetophobia, you can too. If you're looking for more support, check out some of the emetophobia communities on Reddit where people share their experiences, what's helped them, and even small wins along the way. Sometimes just knowing that you're not the only one can be a huge step towards healing. So what's one thing you've avoided because of your emetophobia? Let me know in the comments. I'd love to hear from you. And if you found this helpful, send it to someone who might need it. You never know who could use a reminder that they're not alone. Take care of yourself, and I will see you next time.